Hello everyone, we are representing Group G for the Pathology Model Exhibition, and today we are going to describe the topic Carcinoma cervix. The model, as you can see shows the longitudinal section of the female genital tract, which shows the vagina, the cervix, the uterus, the fallopian tubes and the ovaries. The cervix is the lower part of the uterus connecting it to the vagina. The outer part of it is lined by squamous cells, while the inner canal contains columnar glandular cells, and the area where they both coexist is called the transformation zone, which is the most susceptible area for carcinoma. As you can see in the model, the cervix shows a cauliflower like pale mass, which is the tumor. It develops primarily from HPV, particularly types 16 and 18, which is high risk HPV. It is the fourth most common cancer in females, and it has good prognosis. Globally, it accounts for 6.3% of all cancers in women, and in India it accounts for 16 to 17% of all cancers in women.
Now, moving on to the per speculum view, this is a view of the cervical os which has been retracted with the help of an instrument called a speculum, and hence it is known as the per speculum view. There are two types of speculum, the cuscose speculum and the seam speculum. The seam speculum is the one which is commonly being used in a hospital at Solapur. The view shows two different sections, one side showing the lesion of invasive cervical cancer, which shows fungating cauliflower-like growth and areas of necrosis, hemorrhage and ulceration. On the other side, we can see the visual demonstration of the neoplasm done with the help of a procedure known as colposcopy. It is a procedure which uses a colposcope to visualize the cervix and the vagina. Here we paint the specimen for visualization, and the areas where dysplasia has occurred shows changes in color. We use two different types of stains here. First, we apply 5% acetic acid, which causes abnormal dysplastic cells to turn acetowhite due to protein coagulation. Another stain which we can apply is Lugol's iodine, which stains glycogen-rich normal squamous epithelium brown, and abnormal areas remain unstained, which are called iodine negative. Interpretation of this demonstration is thin acetowhite area implies CIN1, dense acetowhite area or coarse mosaic punctuation implies CIN2 or CIN3. Atypical vessels are suggestive of invasive carcinoma. Lugol's iodine negative implies abnormal epithelium, which may be CIN or a cancer, and squamo-columnar junction not visible indicates unsatisfactory colposcopy.
Now moving on to histopathology, the most common pattern seen here is the squamous cell carcinoma. Squamous cell carcinoma is composed of nest and tongue of malignant squamous epithelial cells, either keratinizing or non-keratinizing, which invade the underlying cervical stroma. In the cervix histopathology, the following patterns are seen. As shown in the diagram here, the most common pattern seen in 70% cases is moderately differentiated non-keratinizing large cell type and has better prognosis. This pattern shows nest of large malignant squamous cells with individual cell keratinization but without any keratin pulse. Next in frequency, seen in 25% cases, is well differentiated keratinizing squamous cell carcinoma. It consists of nest of keratin cells which forms concentric whorls known as keratin or epithelial pearls. Lastly, we have poorly differentiated squamous cell carcinoma seen in 5% cases, which has primitive appearing tumor cells with scant cytoplasm and little or no keratin.
Moving towards gross specimen, consisting of uterus, cervix and adjacent structure. The cervical canal is obliterated by polyploidal, necrotic, cauliflower-like mass.
Now let's see the clinical features. In the early stages, it may be asymptomatic. As the cancer progresses, symptoms become more severe. In the early stage, the symptoms are abnormal vaginal bleeding, unusual vaginal discharge, pain during sexual intercourse, pelvic pain. In the advanced stage, the symptoms are severe pelvic pain, heavy vaginal bleeding, difficulty in urination or blood in urine, bowel issues, severe fatigue and weight loss, swelling in the legs. In the end stage, the symptoms are uncontrollable pain, kidney failure, severe infection and sepsis, loss of mobility, and fatigue.
Now moving on to the investigations. Firstly, we have the screening tests for early detection. Here we have the pap smear, which detects abnormal cervical cells. Then HPV DNA test, which identifies high-risk HPV strains that cause cervical cancer. Then for confirmatory diagnosis, we have colposcopy and biopsy, also endocervical curettage. Then for detecting tumor spread, metastasis, and for staging, we have imaging tests like pelvic ultrasound, MRI, CT scan, and PET CT. And some additional tests which we have for treatment planning are chest X-ray, cytoscopy and proctoscopy, CBC, and KFT.
Thank you everyone.